Today I'm going to be informing you about Cushing's disease in horses in the process category. Meet Pretty Boy. This is my 17-year-old horse who has Cushing's disease. I was around 14 whenever I first got Pretty Boy. I had just outgone riding my pony and was looking for a bigger horse that was better suitable for me at the time. We searched long and hard, looking for the perfect one. One day my pony got sick. A vet from Auburn came out to help her and help her get better. My mom asked the vet if she knew anybody that was wanting to sell a horse that would be good for me. She told us that she had been fostering a horse that had Cushing's disease and she was looking for a good family to take care of him. And that's whenever I met Pretty Boy, and I automatically knew that he was the one that I wanted. But with Pretty Boy came his disease. This was something that my mom and I were both kind of worried about, not knowing what Cushing's disease was at the time or who this horse really was. But with the veterinarian's help and a lot of research, we figured out that we could take care of him just fine. Now, you might be wondering, what is Cushing's disease and what does it have to do with me and how is it going to help me? I'm here today to tell you about Pretty Boy's story and some interesting topics that might help you recognize one day if your animal is caught with Cushing's disease. Let's start by figuring out what Cushing's disease is. Cushing's disease, also known as pituitary pars intermediate dysfunction or PPID, is a dysfunction in the pituitary gland. And the pituitary gland is located on a horse's brain, as the arrow is pointing right here, the anterior pituitary. So like I said, it's basically just a dysfunction that causes this disease. Horses are not the only species that are at risk with getting Cushing's disease. Humans, as well as cats and dogs, are eligible with getting Cushing's disease, although horses, cats, and dogs are more likely to get it rather than humans. But it is possible. Cushing's disease is caused by too much of a hormone called cortisol, which is produced by the adrenals, or two small glands that sit up on top of the kidneys. According to Kentucky Equine research staff, all horses can be at risk of Cushing's disease. Estimate states between 20 and 33% of all horses develop Cushing's disease by the age of 20, which affects up to 1/3 of older horses. There's a long list of side effects to Cushing's disease, and most of these are seen in Pretty Boy, and this is what helped the vet determine that Pretty Boy had this disease. So one side effect is excessive hair growth or lack of seasonal shedding. This is when they grow really furry hair in the winter, unnaturally excessive hair growth, and it's extremely hard for them in the summer to shed it as fast as other horses. As you can see in this picture, this horse's hair is very, very tangly and curly, which will help determine that a horse actually has this. Pretty Boy gets this a lot in the wintertime, and whenever it's raining, it tends to curl up a lot. This shows that a horse does have Cushing's disease. But with hair can also come a lack thereof, which is also found in Pretty Boy. This was in the summer of 2018 when he had just got done shedding his winter coat. And as you can see in some of these black areas, this is where there was barely any hair at all left on his body. And it was kind of concerning to us because we'd never seen it before, but the vet told us that it was extremely common in horses. Also with this disease causes laminitis, which is an inflamed horse foot, which causes sensitivity. So as you can see, this is a healthy hoof. That's a horse. And in this lamellar layer, right here in this white part, this is strong and stable. But a horse with an acute laminitis has an inflamed lamellar, which causes it to fail and produces a bunch of sensitivity on the hoof, which can make a horse really uncomfortable. This is caused by eating too much grass and getting a lot of sugar intake, but it can also cause colicking. Colicking causes abdominal pain and is fatal to horses. It's basically whenever their digestive system has something going on with it, whenever a horse takes too much sugar in. When a horse colics, it kind of paws. The signs of a colic is pawing on the ground and rolling around. When they roll around, this can twist their intestines which causes blockage, which this is not good and it needs to be caught immediately or a horse could actually die from this. Pretty Boy has done this a couple of times and let me tell you, it is so scary. But we've learned to take precautions, especially in the summertime when the sugar is the most effective on the grass. So we lock him up at night in a restricted area, which is called a round pen in our pasture, so he won't take in too much sugar and have this. Another side effect can include excessive thirst and urination and regional disposition of abnormal fat pockets, which in this picture you can see the fat pockets are usually located in the hips, in the shoulders, in the mane, and above the eyes in the eye sockets, which is all where Pretty Boys are. There's certain tests and medication when it comes to Cushing's disease. So to figure out if a horse has Cushing's disease, a lot of times the vet will take blood work. Blood work will collect certain hormones in the blood to see if the levels show a decrease, and if they do, that proves that in fact your horse does have Cushing's disease. It's non-curable, but the medication certainly helps and is proven effective. The medication, like I said, is effective, but it is not cheap at all. Permax is the medication regularly used for horses. It's a dopamine agonist which regulates the pituitary gland, causing the horses to be stable and be able to live their life like normal. They take it for life, they never go off of it, and they take it once a day, which I thought was very interesting because, some people, like some humans, take medications once a day like horses do, and I found that interesting. So Pretty Boy is doing really good, and he has taken this medication for a while, and it's helped tremendously. There have been times whenever he has not taken it that it's proven that a horse really does have to take it. It doesn't hold him back from not having the regular horse lifestyle. He's able to be ridden, and he interacts well with our other horses. And although your animal may not have this disease, it is very necessary that you learn about what Cushing's disease is, the side effects, and how you can possibly treat it in case it shows up. Hopefully one day there will be a cure to this disease. Thank you so much for listening.